This is the U.S. epi curve with the U.S. vaccination rates. A little over half fully vaccinated, 60% with at least one shot, but averaging over 140,000 cases and getting close to 1,000 deaths a day. And if we look at Alabama, now averaging over 3,500 cases a day, 2,700 or so hospitalizations, 27 deaths. I do make note that we're creeping up slowly, but creeping on the fully vaccinated. I think it's taken us 2 months to go from 34% with 47% having at least one dose. Taking a look at the places important to me, this is my list of places I track. I was really struck by this Mobile County data. This is the first time we've seen the arrow going in the other direction since this latest surge. If the trends follow the way they have followed in the past, and we track the way that Mobile County and Baldwin County and other southern tier counties track, that would indicate a peak here of still some time to go to at least a couple of weeks. The UA system dashboard is back up this week for the first time since the summer. So it includes vaccine administration data, which don't really help a lot because this number obviously includes a lot of community vaccinations, but it does show employee vaccination data, 72% here at UAB, and it shows student, faculty, staff, and clinical enterprise cases by week. I encourage you to start tracking this again, because this will be completed each week.
I can answer the question you've been asking a number of times. How many investigators do we have?
Okay.
As of today, we have 62. 40 of those are either 34 are current students, 6 graduated in 21. There are 22 temporary UAB temporary service folks, making a total of 62. We have 13 in the wings, all of whom are students. They are in various stages of getting their information in so we can get them signed up. One of those is a volunteer. So if those come on board, we'll have 75 investigators, 53 of whom will be students. Starting sometime Monday, we will pivot where about half of our investigators will be in the process of reviewing laboratory reports in order to create cases within ALNBS. DrPH has been overwhelmed with laboratory results, and they've been unable to catch up with the number of cases. So for 2 to 3 weeks, we're going to be processing about 10,000 laboratory situations per week until we can help them catch up. And then after that, we anticipate about half of that number, 5,000 a week, for the duration of the project, or until these cases come down. To give you an example of the level of the situation today, we had a capacity to handle about 87 cases. There were 1,075 cases that were created yesterday in ALNBS, and we were assigned about 80 some of those. The 1075 represents all of the cases that exist that DrPH could not process themselves. And I don't know how many they are doing, but it's typically been the several hundred, 200 or 300 a day. So that kind of gives you an idea of the scope of the crisis at the moment. And this does not include Jefferson County and Mobile County. This is the rest of the state, all counties that aren't Mobile and Jefferson County.